Hi viewers, myself Dr. Abhilash. All the parents should be taking utmost care to examine their child. Are they able to retract the foreskin or not? If they are not able to retract the foreskin, that condition is referred to as phimosis, and we have discussed in the other videos what are all the possible complications that can happen. So right now, what are all the treatment options for phimosis? To start with, most of the people will be of the concern that can phimosis be treated medically? The answer is absolute no, because it's a structural deformity which has to be corrected only with the surgery. So what are the surgical options for phimosis? Means the surgery which is commonly performed worldwide for phimosis is circumcision. What we'll be doing in circumcision is the extra foreskin is removed to such extent that the foreskin opening will be wide enough so that the patient will be able to retract back the foreskin to clean the glans penis. So in that surgery, what anesthesia will be given for surgery means it all depends on the age of the patient and a pain tolerance of the patient. If the child is young enough and his pain tolerance is low, then such child will be advised for sedation and circumcision because they may not be able to cooperate for surgery. If the child is mature enough and if he is tolerant to pain, or in adults, what we do it under local anesthesia, where we'll be administering small injection over the foreskin region to cause anesthesia of the part. Thereafter, the surgery is going to be completely painless and there won't be any significant amount of pain during surgery at all. What all the treatment options are available for circumcision is, we do have a conventional or open circumcision method, we do have a laser circumcision, and we do have the stapler circumcision. Out of all these three, my personal choice would be a stapler circumcision because it is completely sutureless and it is bloodless and it gives the best cosmesis of all the three as per my personal choice. So what we exactly do in a stapler circumcision is, in conventional open surgery, we need to cut the foreskin, and after cutting the foreskin, we need to stitch it up so that sutures will be placed to approximate both the edges of the cut edges of the foreskin. The same thing happens in a laser, but the cutting happens with a laser. The advantage of laser over conventional is it will be bit relatively bloodless. Compared to laser surgery also, stapler is completely sutureless and the duration of surgery for stapler circumcision will be very less. What are all the advantages of stapler, or how exactly a stapler works is, if suppose we want to make some coffee or tea, we need to boil the milk and we need to boil it to such extent that after boiling the milk, we need to mix the coffee or tea powder, we need to stir it up, and then we need to filter that, and then we need to pour it into a glass. If the entire ingredients are already pre-packed in a machine, with a single press we will be getting a coffee that we commonly refer to as espresso coffee machine. In the same way, that the same thing happens in the stapler also. We don't need to cut and we don't need to stitch. Everything with a single press, we can achieve all these steps through a stapler circumcision. But this stapler is also a one-time disposable piece and that will be used only for a single patient, and once after using it, we'll be disposing it. So the advantages will be, the duration of this procedure will be hardly a 5 to 7 minute procedure in a stapler circumcision. Unlike in laser circumcision or open surgery, it may be taking somewhere between 15 to 20 minutes. And after stapler circumcision, there won't be any stitches placed. What will be left is something called as a silicone ring, which is self-dissolvable. After approximately 2 weeks of the procedure, that silicone ring gets detached at one place, the entire ring will fall off all by its own. So the advantage is there won't be any stitches, and cosmetically it will be too good. Even for diabetic patients, there won't be any risk that, because just after circumcision, if you notice, there is no wound per se. So if there is no wound, there is no risk of infection also. So cosmetically wise or the rate of infection wise, stapler circumcision will be best, and the recovery will be also fast with a stapler circumcision. Many people do have concerns or queries that what are all the complications or side effects after a circumcision surgery. To clear all their doubts, or most people will be asking about two things: will there be any problem during sexual intercourse, or will there be problem for childbearing and all? So to speak with, just if you go for a haircut, there won't be any underlying brain damage. In the same way, In the circumcision surgery, we will be dealing only and only with the foreskin. Nothing is being done to the penis or to the testis, because for childbirth and all, the main thing needed is the sperms from the testis, which is completely unrelated to circumcision surgery, and for sexual intercourse and all, the thing needed is the penis. So we are dealing only with the skin covering the penis, but not with the penis. So there won't be any side effects or complications after a circumcision surgery. If you put it in the other way, there are advantages with circumcision, because if we look at the worldwide statistics, the incidence of penile cancers is very less in people who have already undergone a circumcision surgery, because right from the childbirth, if they have undergone circumcision at a very early age, there is no concept that the smegma is not being cleaned properly, and there is no risk of infection, and there is no dirty things that are getting pulled up. So these people have a very low risk of cancer compared to a non-circumcised group. So circumcised people always do have a health advantage compared to non-circumcised people.